That's a great question. Getting started in healthcare in general, or healthcare IT in specific, is probably not as hard as it seems. Almost all of us know one or more people in the healthcare field, whether it's a nurse, a local physician, maybe a local hospital, etc. So the getting started part from a overall perspective is not that difficult. Where it gets a little bit more difficult is if you're trying to jump into health IT specifically, trying to find out which areas you're most interested in and where you can do the most amount of help without affecting the workflow in the area that you're going to jump into is probably the most difficult part. So the best way to get started there is, and I've written a couple of these articles on my blog on where to start in healthcare when you're brand new. Or where to start in health IT when you have maybe a healthcare background but maybe not an IT background. So the answers are a little bit different on both sides, but either way they start like this. There is a lot of volunteer work that is done at hospitals, at clinics, etc. So, go to your local church clinic, go to your local hospital, and look at what volunteer opportunities there are to first and foremost concentrate on the healthcare industry side of the equation. Forget the IT side. The IT side is something you can be taught and learn pretty easily on your own. But the healthcare side and how it works and how insurance works and how to care for patients, what the clinical workflows are, those are actually pretty difficult. So I tell people when you're getting started, just go to your local healthcare institutions, find out every volunteer opportunity you can, whether it's at a nursing home, hospital, clinic, as I've said before. So it's actually not as difficult to get started as it sounds. Now, if you've already got the health care experience and now you want to move into IT versus you've already got IT and you want to move into healthcare, then I would say that the best place to start is in customer service, customer support, potentially helping with marketing, sales, product development in these areas at existing IT firms. So whether it's a big company like HP, Dell, etc., or small companies like electronic health record vendors, practice management firms, etc., they all really are looking for folks with healthcare experience, so that their customer service, their support, product development, etc., gets better and better. Another area where you can start immediately helping is there are a number of open source tools that are being built to help out these kind of same settings, whether it's the hospitals, clinics, etc. And you can start to participate if you want to do programming. You can start participating immediately because most open source tools, as we know, are a meritocracy. They don't care how much experience you have. They don't care what you did in the past. They only care about what can you do for the project going forward. So the open source tools, for those of you who have IT experience and want to get into healthcare, that you should concentrate on would be if you just do a search for open source health tools or open health tools, you'll see a number of responses there. So on the outside, it looks very difficult. How do you get in? It's a big world. And do I know enough about healthcare or not? Everybody knows enough about healthcare to be able to get started. Every human being knows enough about healthcare, taking care of people, being nice to people, etc. So there's a lot that you can get started with if you have confidence in yourself and say that what I know is applicable in healthcare. And there are no fields, whether it's banking and you're moving from there, IT, etc. There are no fields that don't have some linkages to healthcare. So the best advice I can give is just get started. Find the volunteer places or find some projects that you can work on, and they're actually pretty straightforward.